We're doing really well here, Neil, and you?
Fantastic. And today's topic is dangerous headaches during pregnancy. What kind of headache is caused by preeclampsia?
It is a throbbing headache. It's probably the worst headache you've had in your life, and it comes on usually after 20 weeks, but more often probably around term, 35, 36 weeks. Some of them start out not very severe, but if you have this kind of a headache for more than 24 hours, you should see a doctor.
How can you test for preeclampsia at home?
Well, unfortunately, there is no specific preeclampsia test for home. You can check your blood pressure if you happen to have a blood pressure monitor. Of course, you should be able to talk with your doctor about that. If you have vision changes, right upper quadrant pain, those things can all be associated with high blood pressure.
What does a pre-stroke headache feel like?
It is a throbbing headache. In other words, every heartbeat you can feel in your head when going to be the worst headache you've ever had in your life, and you might be incapacitated. In other words, you just want to lie down and go to sleep. You can't even figure out to call your doctor. So be careful. Nice to have good friends around that'll call the doctor for you.
What are the warning signs of a stroke?
Well, sudden numbness or weakness, especially on one side of the body, sudden confusion, difficulty speaking, understanding speech or calculating, sudden vision changes with difficulty seeing or blindness, and then, of course, trouble walking, dizziness, loss of balance, and headache. Like I said, the worst headache ever.
What are cluster headaches?
Well, they are very severe, and they are called cluster headaches because they occur in clusters. And the good news for moms is that they're 6 times more likely to occur in males than females, and they affect 1 in 10,000 adults. Symptoms include watery eyes, swollen eyes, blocked or runny nose, sensitivity to light and sound like a migraine, restlessness, and agitation. They can last between 15 minutes and 3 hours, occur up to 8 times a day. They do, as I said, occur in clusters. The treatment includes oxygen therapy, sumatriptan, which has been around for about 30 years now, comes in a pill or a shot, verapamil, which is a blood pressure medicine, steroids, melatonin, and lithium.
How does a headache caused by a brain tumor present?
Again, this will be one of the worst headaches you've ever had. They tend to come on gradually, and they are associated with um, trouble walking, tripping, and lack of coordination, difficulty picking something up. So, neurologic changes.
What test is safer in pregnancy, CT or an MRI?
Well, the CT has a lot of x-rays, and it is possible to get a CT during pregnancy, I think. There is such a thing as a lead apron, which can be placed over your uterus for protection. Then the MRI is a big magnet, and um, the problem with the MRI is that you have to go into a tube, and if you have claustrophobia, that tube is going to be difficult for you.
What is a brain aneurysm?
Well, brain aneurysms come in different forms. There's congenital, which means to be born with. That's an enlargement of an artery, and it's associated with weakening of the artery walls. A congenital aneurysm is associated with rupture during times of stress, like high blood pressure, such as in labor and delivery with pushing.
Okay. All right. Let's go to the next question. How do you know if your brain bled?
That is difficult to diagnose, but a brain bleed doesn't always show up right away. They can be, like I said, congenital, or they can be trauma associated. And most of the times they are associated with an injury like a car accident, a four-wheeler, falling off a ladder, falling backwards, hitting your head on a cement sidewalk or floor. They might not show up right away on a CT scan, although we think they do, but they don't always. So it's important to follow up. For example, you might want to routinely just check in a month or so, or even 2 months after the trauma event. Um, but if you're having trouble, say, for example, you develop a severe headache, confusion, loss of consciousness, trouble with coordination, that would be a time to call your doctor and to get your MRI.
All right. Best place to go is ruraldocallen.com and pick up Pregnancy Your Way, available today and